Now we'll quickly try to look at articular cartilage erosion. So you have a cartilage, then all of a sudden the cartilage is eaten off, so to say. Alright. Articular cartilage erosion. It's also known as chondrolysis. Of course, the chondrocytes are the cells of the cartilage. As they are breaking down, another name for breaking down is lysis. So that's how we derive the name. So articular cartilage erosion is also known as chondrolysis. Is a rapid breakdown or loss of cartilage in a joint. Most often, you see that in joints of the shoulder, joints of the hip, joints of the knee. Do you understand? So what is chondrolysis? It's rapid destruction of articular cartilage. So it will now expose the bone that the cartilage usually covers. So the bone that is under the cartilage is now subchondral bone. So it will expose it. So it usually occurs around the shoulder, glenohumeral joint, around the hip, around the knee. So what could cause it? Maybe after a surgery like arthroscopy. You understand? Iatrogenic injuries, radiofrequency, devices, and suture anchors. Local anesthetics. Maybe there have been inflammation around the joint or infections around the joint. It could be due to trauma or repetitive mechanical stress. All right. So you're using that part too much. You understand that kind of thing now. All right. So symptoms. There's a lot of pain, stiffness, and restricted range of motion. You're not able to move like you used to before. There could be swelling and inflammation. There could be rapid progression to functional disability compared to slower degenerative conditions like osteoarthritis. So diagnosis is use X-rays, MRI scans. All right. So differential diagnosis, it could be other things like osteoarthritis, it could be chondromalacia, could be osteonecrosis. How about the treatment? Treatment is conservative, pain management is what? NSAIDs, physical therapies to maintain mobility, avoidance of further intra-articular anesthetic exposure. So surgically try to debride or lavage, or you can also replace the whole joint if the issue is so severe, you know. So you also give some one or two medicines that will kind of like reduce the inflammation as corticosteroids, and also medicines to kind of like increase the lubrication around that place. That's what hyaluronic acid is. Okay. So I think this is what we have with this articular cartilage erosion.